Hello everyone and welcome to Module 7. This week we are going to be focusing on one of my favorite topics, phlebotomy, blood collection, and capillary punctures. So with that we are looking at one chapter. It's going to be chapter 42. Now you're going to be looking at a couple of different sections. So you're going to be looking at the laboratory classifications and regulations, safety in the medical office and laboratory, safety in the POL or the physician's office laboratory, and the equipment that is used within the POL. So let's go ahead and jump into this and see what we've got. Now it's important that you understand why we use the clinical laboratory and what the purpose of a clinical laboratory is. It is helpful not only for the physicians, but also our patients in providing a way for us to screen for diseases, to confirm a condition that is suspected by a physician, to rule out a condition, to establish a baseline level for medications before they're administered, to monitor the effectiveness of a medication or a treatment plan, and then to assess the progress of a disease. Now, laboratory tests will generally fall into one of two categories. They will either be qualitative or quantitative. Qualitative tests will give you a result that is either positive or negative for the presence of a specific substance. So for example, if you're doing a pregnancy test, your results will either be positive or negative. Quantitative tests, however, will give you a numerical value. So when we do things like a glucose test or if we're testing a hemoglobin, all of those will give us a numerical value where a qualitative test will give us that positive or negative. Next thing we're going to talk about is understanding the amendments and fundamentals of quality control and quality assurance. Quality assurance for you as the medical assistant is one of the things that you are most responsible for. We do this by carrying out the procedures that are involved with planning and the systematic activities to ensure that the requirements are met and results are accurate for our patients. Quality assurance should include quality control, orientation of personnel, documentation of quality control logs, maintenance checks on all equipment and instruments, required calibrations of instruments, temperature checks on refrigerators, freezers, and equipment, checking the expiration dates on test kits and reagents, and providing proficiency testings. Quality assurance also developed what we call the reference values or the normal values so we can tell whether or not a test is running accurately. Quality control is focused on the physical proof that results are accurate. This is done by routinely performing mock tests on either something called the calibration or a controlled solution. A calibration is specifically prepared test strips or cartridges that are designed to produce a predetermined result, where a control solution is a chemical that is produced with an expected result and is similar to the testing specimen. Now, it's also important that we understand and discuss some of the important laboratory regulations. The first important one is the amendment that you need to understand, and that is CLIA, or the Clinical Laboratory Improvement Amendment of 1988. It was created to protect patients by having safety policies and procedures. The amendment addresses issues of quality control, quality assurance, record keeping, and qualifications of the personnel performing tests. It was established to help set standards to ensure test accuracy, reliability, and timeliness regardless of the type of test. The regulations consist of 4 sets of rules: laboratory standards, user and application fees, procedures for enforcement, and approval of all accreditation programs. So all labs must not only register with CLIA, but they also have to be approved by CLIA in order to completely run and do patient samples. The other amendment that we need to know and be sure that we're following is OSHA. Now, we've spent a great deal of time talking about OSHA, so I'm not going to go into depth in this video, but understand and hopefully you remember that OSHA stands for Occupational Safety Health Administration. Now, this unit is focused on phlebotomy and blood collection. So you may actually hear me say phlebotomy or venipuncture, but please know that those are the exact same thing. It's just a different way of saying the exact same term. Blood collection, or venipuncture, phlebotomy, is where we make a tiny incision in a vein to collect a blood sample, and it's typically done with a hollow needle. So let's start off by discussing what is your role as a medical assistant in this procedure. Your role will be to collect, label, and possibly process or even store a sample based upon what your lab at your office can do. You will also need to make sure you have a basic understanding of the circulatory system, the phlebotomy equipment, asepsis, and the venipuncture procedures. So when we talk about the equipment, there are a wide variety of equipment that are used for phlebotomy procedures depending on which one you are performing. But you will need things like blood collection tubes, double-ended needles, tourniquets, tubes, and tube holders, and syringes. Now, we're going to spend a great deal of time in the lab this week talking about those things, so I'm not going to go into depth on the video, but I would highly recommend that you guys actually look at those pieces of it in your book and have a good understanding of each of them before you come to the lab this week. When we talk about a venipuncture procedure, you know a little bit about it probably from your readings, but the procedure can be performed in several areas of the body, but the most common is going to be that antecubital space or the bend in your elbow. And in the bend in your elbow or the antecubital space, there are 3 main veins that we're going to use. The median cubital, which is going to be the most popular vein to use. It's right in the middle of the arm, and it's typically going to be not only the largest, but the most well-anchored vein that we have in our bodies. Second choice is going to be the cephalic vein. This can actually be found on the outer edge or the thumb side of the antecubital space. It's still fairly large, but it's not as well anchored as your median cubital. So you don't want to use this one first if you do have a good median cubital vein. And our final one that we would use would be the basilic. Now, we don't want to use this one unless we absolutely have to, for 2 reasons. One, it's not very well anchored, and it's right above your basilic artery. So if you go in a little too far with your needle, you could nick that artery. So we don't want to do that. Now, your basilic vein is found on the inner edge or the pinky side of your antecubital space. So now we've talked a little bit about the procedure and the placements. We've talked a little bit about the equipment. Let's go ahead and talk about the different types. Now, there are 3 types of venipunctures. We have the evacuated tube method, the butterfly method, and the syringe method. The vacuum tube method, or the evacuated tube method, is the most common because it allows us to take multiple samples without having to do multiple sticks. So we would just change tubes out as we do this. And we use these tubes that have a vacuum in them, and the vacuum is set to the exact amount of sample that is needed. So what happens is they actually withdraw an amount of air, and then that can be filled with sample, and it will only allow that much sample in. It will not allow the tube to overfill. Oops. Next we have our butterfly method. This is called a winged infusion method also. What we have is a needle that attaches to a tubing, and at the end of the tubing you can either attach a syringe or a tube holder for evacuated tubes. This is used for smaller veins that are difficult to draw on, or even children, because it allows some flexibility in the arm. And then we have the syringe method that is used to collect samples from small, fragile veins that cannot withstand the pressure of the evacuated tube method. The drawback to this method is that you can only draw as much sample as you have a syringe size, so you're very limited on how much you can actually draw. Another very important piece of this topic is going to be the order of draw. Now, the reason that the order of draw is so important is because it prevents cross-contamination between tubes with skin bacteria and other additives from tubes. So the correct order of draw is kind of what you see here, except for the fact that you would use yellow or blood culture bottles first, then light blue top tubes, red tops, red marbles, greens, light greens, lavenders, pink, white or royal blue, gray or dark blue are last. All right, so that is what I have for this week's video. I know it doesn't seem like I went over a lot, or maybe I went a little too fast, but again, we're going to spend a lot of time in the lab this week really getting to know these different orders of draw. Oops, that's not what I wanted to hit. Getting to know the orders of draw, going through the equipment, and kind of letting everything kind of come back into place. So don't be overwhelmed. If right now you're like, oh my God, this is never going to happen, I'm not going to be able to do this. The first couple of times are a little overwhelming. To be honest, it's very much like when you guys did your first injection. Okay, it was really scary, you didn't want to do it, it was overwhelming, but then after you did it, you realized it wasn't that bad. Phlebotomy is the same way. We're going to do a couple of practice runs on the fake arms that are in the back of the room, and we're actually going to move out to real arms. We're also going to do some capillary punctures, so we'll kind of go over all of that material when we're in class this week. I don't want you to be afraid coming to class. I am really, really good at this. I've been teaching this piece of it for so long that even students who are like absolutely terrified of it have done really, really well. So don't be alarmed, don't be worried, don't be scared. I'm not going to let you hurt anybody. I do have one request. Please make sure that you have consumed quite a bit of water. It makes it a little bit easier if you have drank a lot of water to help kind of make your veins pop out and make it a little bit easier on your classmates that are drawing on you. So please make sure that you drink plenty of water, and I will see all of you bright and early Thursday morning, and we're going to be talking about phlebotomy, blood collection, and capillary punctures. Have a great week, guys. Bye-bye.